Now we will see the sign and symptoms. So the patient can present with jaundice, that is, he is having yellow discoloration of skin and sclera. So if the patient is having jaundice, then it will quickly point out that cause is in the gallbladder. It can be due to gallstones. So if the patient of acute pancreatitis is having jaundice, you will definitely keep that he is having some problem like gallstones. Then next is ARDS, acute respiratory distress syndrome. The patient can present with cyanosis or he can have type 1 respiratory failure, because acute pancreatitis can cause microthrombi in the pulmonary vessels. So patient can present with respiratory distress syndrome as well. So never forget this point. Again, the GI symptoms, which are epigastric pain, because pancreas is a retroperitoneal organ. When it gets inflamed, the nerves are stimulated and there is constant epigastric pain which radiates to back, and it is relieved on leaning forward, and it gets worsened if you lie supine. So non-colicky and constant epigastric pain radiating to back, this is a feature of acute pancreatitis, and the pain can be associated with vomiting as well as nausea. Next, important is acute renal failure, because acute pancreatitis patient suffers intravascular volume depletion. He can have dehydration, and that dehydration can lead the patient to acute renal failure. So these, although this is a manageable condition, but if the patient gets acute renal failure or acute respiratory distress syndrome, then things become very difficult. So these are very life-threatening complications, and some patients, they present with these complications. So it needs to be managed very carefully. Next is the Gray-Turner sign. What happens that among pancreatic zymogen enzymes, there is the enzyme elastase, and this elastase enzyme, it causes hemorrhage. It causes hemorrhagic pancreatitis, and that hemorrhage will present as bruising. There will be bluish discoloration of the flanks, that is called Gray-Turner sign, or there can be bluish discoloration or ecchymosis around the umbilicus. That peri-umbilical bruising is called as Cullen signs. So Gray-Turner signs and Cullen signs, these are the important signs which point out to hemorrhagic pancreatitis. And finally, patient can have abdominal complications. Now what complications can arise? What if the pancreas gets infected? There can be pancreatic abscess. If there is cyst formation, then patient can develop pancreatic pseudocyst, or a very dangerous situation when pancreas is started to be necrosed. So there can be pancreatic necrosis also. So to summarize, the patient can present with simple features like pain, nausea, vomiting, jaundice, or he can have severe complications of respiratory failure or renal failure, or abdominal complications in which there is pancreatic abscess, pseudocyst, necrosis, or even ascites. And the important signs that you look for in the patient are Gray-Turner sign and Cullen sign, which will help you to differentiate acute pancreatitis from other causes of acute abdomen.